Hi, it's Amy Genson, Geriatric Care Manager and owner of Genson Geriatrics Management. Happy August. I hope you've all been enjoying your summer. Did you know that pet ownership may be a factor in improved health of older adults? For older pet owners, pets can help reduce stress, lower blood pressure, increase social interaction, and physical activity. Pets can contribute to healthy aging and even longer life. Studies suggest that pets can positively influence factors that contribute to longevity. Scientists have even found that dog owners are likely to live longer than those who don't own a dog. According to a recent study, pet owners are 12% happier than people without pets. Pets reduce stress, anxiety, and depression, and help ease loneliness. There are, however, other factors to consider when having a pet. There's the cost of having a pet, and pets also present an injury risk. Roughly 86,000 injuries a year are reported in the US due to pets, usually tripping over them. In all, 55% of adults ages 50 to 80 have a pet. In spite of all of the positives that come with pet ownership, today we're going to touch on a topic that many may never have considered. Who is going to take care of the pet's daily needs in the event of the older adult's declining health? And then there's the difficult question: what will happen to the pet if its owner passes away? This month's monthly spotlight guest is Heather Donley, the Executive Director of Assisted Home Health Foundation. Her organization is a 501c3 committed to providing home health and hospice to underserved individuals in the communities they serve. Assisted Home Health Foundation found a community need between patients and pets and developed Hands to Cuddle, Paws to Love. The program provides access to pet resources so pet and patient can remain together during transitional periods or until the end. Assisted Home Health Foundation supports our local community and keeps patient and pet together for as long as possible. So welcome, Heather.
Thank you so much for having me and for allowing Assisted Foundation to bring awareness to Hands to Cuddle, Paws to Love. Our program provides resources based on partnering with local community resources that can provide whatever missing component somebody needs to be allowed to keep pet and patient together until the end. So we provide grooming services, veterinarian care, we provide walking, companionship, and ultimately, like you touched on, placement, which is a big piece of what our program provides support to the community.
Wow. So, does someone need to be an assistant client to benefit from your Hands to Cuddle, Paws to Love program?
No, all we ask is that they're on with a home health or hospice agency. It does not need to be assisted, although mostly it is assisted clients receiving the service only because we have wonderful ambassadors in the community that can identify the need and share with them the program. So remember, you do not need to be on with assisted home health or hospice, but you do need to be receiving services from a local home health or hospice agency.
And then we would just reach out to you and say that we have a potential candidate who could benefit from your services?
Yes, you could visit us on our website, www.assistedcares.com, or you can contact the foundation directly at 805-379-3656 and ask for myself, Heather Donley, and we can fill out the paperwork together and explore what resources we can provide to you so that you can stay together with your pet until the end.
So going back to the services that
Sure.
Hands to Cuddle, Paws to Love offers,
Yes.
um, if you have somebody who's receiving intermittent, meaning a couple times a week, home health services,
Yes.
but Fido needs to go for a walk twice a day, is that something that your program is able to offer?
Y- Prior to COVID, yes. Right now, our program is really in the rebuilding stages of identifying volunteers who can provide volunteer services multiple times a day. The volunteer looks very different in terms of availability than what they did pre-COVID. So we're trying to adjust to the new world that we live in, and we're taking every volunteer schedule with so much pride, because to volunteer is a special quality, and to give your time to an organization, we feel very proud of our volunteers. However, with that being said, life happens and it looks different. People's schedules look different. So as a result, we're always actively recruiting volunteers so that we can make sure that when the frequency of walking a dog is more than once or twice a day, that we can meet the needs of our community.
Yeah, okay. And we'll circle back to that because I do want to hear more about your volunteer options. But that's just amazing that you guys are able to provide ongoing services as well as, grooming and veterinarian care, which is less frequent than walking, as as I mentioned. So are you seeing that with your patients that their pets bring comfort to their lives?
Absolutely. And I think it's important to remember, like, sometimes these animals have been with their owner through their entire disease process, and the companionship and the stress reducer that an animal can provide to a patient as the disease progresses, and to the family, is a wonderful thing to be able to serve or provide service to the community, and really allowing the patient to have that love in their day every single day. Oftentimes, we have individuals that come to us and say, I can't afford to feed my animal. Or I'll sacrifice my meal so that my animal can eat. We want to make sure that people don't have that. There's peace of mind in whatever resource that they need, whether that is pet food or whether that is ultimately placement, right? Because this loved one that has been with them through, again, their entire disease process, that cat, that dog, who's provided that daily comfort to them. Oftentimes the patient wants to know, well, what's going to happen to that love, my animal who has been with me? Maybe they lack family support structure and they don't have a family. So we try to go in and provide that peace of mind to them, and work really diligently on finding the animal an appropriate home based on what their level of needs are as well.
Oh, that's such a touching caveat that you shared because being a loyal dog owner myself, I get that. I think I would sacrifice my meal for my dog, and also I'd want to know that he's safe and well cared for. And I imagine that comfort that your program is able to provide, that peace of mind, also helps in the healing process because we all know what stress does in delaying our healing. And so knowing that this is one less stress that your clients have to worry about has got to offer them a lot of peace of mind.
Oh, it does. And ultimately, many of the animals that come to our foundation are senior animals, and we take that into consideration when we place them and when we're placing them with an appropriate home, because we want to make sure that whoever takes over their medical needs are met, and that the family or organization that continues to provide love to them is equipped to do so and provide that same loving and nourishing home that they came from. We work very hard on making sure that we work as soon as we get the application in that someone needs our services, that we can start the social media campaigns around promoting the animals, so that we can try to ultimately allow the patient to know where their pet's going to go prior to them passing. Many families, for whatever reason, we provide no judgment, but sometimes they live out of state and they can't take mom or dad's dog, or there's no family involved to provide that care. So again, starting that process when we first are identified that a need is present, and being able to really promote them so that they can find the best home that matches their needs, and allowing us then the opportunity to circle back with the patient and saying, this is where your cat's going to go. This is the family. This is the organization that can provide them the care that they need. It really does provide that peace of mind. And it's a beautiful thing, because that is that four-legged critter, or what, animal, reptile, what do you name it? That is somebody's love. That is their family. So to be able to provide them that comfort is a beautiful thing for people.
Absolutely. Absolutely. The bond between pet and pet owner runs deep. But that leads me to my next question. We've talked about cats and dogs, but is your program limited to just cats and dogs?
No, we've assisted goats, you name it, and we've been able to rehome it. So again, as whatever animal is in need of access to a resource to be able to stay with their loved one, we are equipped to be able to reach out to our community partners and be able to provide that component, whatever it is that is missing, to be able to both keep them together until the end and ultimately place them as well.
Well, there you go. I don't want to, this is not a biased program for just dogs and cats, two-legged
No.
animals, no-legged animals. You mentioned a
Winged,
reptile. So,
yeah, winged animals, everything, you name it, and we can help it as well.
oh, well, I think that's important to know. And then, yeah, let's touch back on your volunteer and fostering programs. Can you tell us about those?
Absolutely. So we're always actively recruiting volunteers who can come and again provide daily walks and maybe feeding. Possibly the individual can afford the food, they just simply can't feed the animal. It may be something as well for volunteers to go in and clean bird cages or clean reptile habitats. Things that we take for granted that are easy tasks to do, but as you're aging, may be challenging to do. I also want to touch on, if you're on home health services and not on hospice services, we also have volunteers that can come out and provide transitional support. Maybe you had a hip or knee replacement for 2 or 3 weeks. You have a 100-pound German Shepherd that you can't bend down all the way to pick up after. We have an amazing volunteer opportunities for individuals that can go and provide that quick service to people. And then after they've recovered, they can possibly volunteer with us because they benefited from our service. So again, if you can be of benefit to the community and provide walking services to dogs or cats or whatever needs to get walked that is in the animal family, as well as feeding services, or if you're a volunteer and you can simply pick an animal up and take them to the groomer, wait for them and bring them back. Those are all volunteer opportunities that we're looking for when we're looking for a volunteer for Hands to Cuddle. In addition, a big piece is fosters, right? It takes time for us to be able to find an appropriate home for an animal. Sometimes we have a lot of volunteers who foster because for whatever reason, they can't adopt the animal. Maybe their living conditions, or they simply can't take more of the animals than they currently have. However, it allows them the opportunity to bridge until we can find that appropriate home. They can provide that short-term loving stability for the animal until we can provide that long-term home, which is ultimately what we want every furry friend to have from us.
And that is why I was so excited to do this interview with you, because I just think that this is, as much as pets are a part of our lives, I feel that preparing for our end stage of life, it's been overlooked, the impact of who's going to care for the pet, or as I said, in our decline and or after our passing. I think it's not a conversation that is talked about much. So I definitely wanted to bring light to your fabulous program. So thank you so much for taking the time to share and to describe this amazing program. And I will absolutely have all of your links and information in this video. But I just want to thank you so much, Heather, for your time and for introducing us to Hands to Cuddle, Paws to Love.
Thank you so much, Amy, and to the community. Thank you for your time. We're honored, and we hope that you'll check us out, and we hope that maybe we can be of service to either yourself or one of your family members in need of hands to cuddle, paws to love.
And and definitely, if any of you are looking for volunteer opportunities, want to give back to the community and to the pets of the community, I will have that information available for you. Thank you, Heather, for your time, and thanks everybody for listening.